Good morning, everyone. Folks know I like a little bit more energy. Good morning. All right. Well, thank you, Dr. Crawford. And I trust I'm as nervous as you are. You know, this in-person thing is like tripping me up a little bit. I rushed down here. I have all different time zones on my laptop, on my phone, on the computer. And I rushed down here. I think it was like 7:30, and I thought it was 8:30. And it's just been an interesting couple of weeks trying to figure out how to do this in-person thing without everything being on top of each other and figuring out how to travel. So I'm here, I'm happy, I'm delighted to be in the presence with all of y'all today, especially this group and Beyond Flexner and Candace Chen and all the work that you've been doing and leading over the years. Just very grateful. And grateful probably to see people I haven't seen in a while. I'm going to call him out because he's been a mentor or mentee of mine, and a mentor, I would say, too. Rohan, wherever you are, if you're here still, just definitely make sure you touch base with me after we're done. But I will say that a lot of the opportunities over the last 3 years for me in this time of COVID, in this time of just heightened awareness of racism and talking and naming racism, that really the students that I've been around and been engaged with, I think many of us who are kind of at my level or at my space have really sustained me and my energy to continue in these spaces to do this work. So I just want to make sure that I'm acknowledging them and their contributions. And so also want to make sure that we are doing a land and labor acknowledgement, and that we acknowledge that we are all living off stolen ancestral lands of indigenous peoples for thousands of years. Specifically here in this space today, we acknowledge the 22 native tribes that have been here for centuries on this land. And we also acknowledge the extraction of brilliance, energy, and life for labor forced upon people of African descent for more than 400 years. And we celebrate the resilience and strength that all indigenous people and descendants of Africa have shown in this country and worldwide. And I carry, and we carry our ancestors in us, and we are continually called to do better and lead in this work. These are two photos. The top photo are students who are at the Oregon Health and Science University's Native American Center for Excellence that has an alternative to traditional medical school admission. And the bottom photo was taken in 2019. That went viral. Many of you may remember it. Students from Tulane who went to Whitney Plantation, was close to where they are, and took this picture, started an organization and a nonprofit called 15 White Coats, supporting and doing mentorship for young people. And I just acknowledge that the tallest person kind of in that bottom photo, Dr. Russell Ledet, he was already a doctor because he has a PhD and an MD, or a PhD and an MBA, and just received his MD, as well as is going to be triple boarding in peds, adult psychiatry, and child and adolescent psychiatry. I didn't even know that was possible. But just again, acknowledging the students and your energy. So I'm at the American Medical Association, founded in 1847. Our work of equity, I would say explicitly, kind of in terms of organizing, I think began more so around 2014. Some of you are aware of the Commission to End Disparities in Healthcare. And it was a partnership between the American Medical Association, the National Medical Association, and the National Hispanic Medical Association, but engaged a lot of other associations as well. 2016, it was, in some level, it went away, to say it nicely. And then there was definitely movement by the House of Delegates within the AMA that, and acknowledge an awareness that they needed to do something much more intentional and explicit. Policy was passed after a task force was created, and the policy stated that there needed to be an organizational unit to address equity and somebody in charge of that unit. And so I came on board in 2019. Now it is known to our staff, so there's the management team, the 1,100 or so folks who work on behalf of the 270,000 members and Medicine Beyond. It is our role and leadership, and Jim Madera is very clear, and the board's very clear, that all the work that we do has to have equity embedded in it, and we need to figure that out from not only an outcomes perspective, but a process and a strategy perspective as well. And so my role and my team's role is really to help facilitate that process. It's not to do all the work of equity or to think of all the work of equity at the AMA, but to help facilitate a process to do so. Also, and I think very foundational to our equity efforts at AMA is policy that was passed in 2020. And I want to acknowledge again the role of the medical student section within AMA that actually approached me a year before in 2019 that they were considering putting forward some policy around anti-racism or racism. And, at that point we weren't, I think collectively weren't clear, was it going to be, accepted or well-liked at that point in time. And then COVID came around, the public murder of George Floyd came around, and we all know what happened in this nation in terms of increased reckoning, increased naming of racism and its roots as it relates to inequities, especially in the context of health. And so I think that definitely helped create a better space and a more willing space to put forward and pass these policies as related to anti-racism and naming racism as a public health threat, ridding our healthcare system of racial essentialism, and supporting the elimination of race as a proxy for ancestry. So from this, it helped support kind of how far and how wide and we could go as it related to putting forward a strategic plan for the American Medical Association. It was our window of opportunity, and we made sure that we capitalized on that window, because we all know these windows can close at any given time, truthfully. And so we have an approach or a strategy that we put forward that has 5 approaches. One, embedding, and I talked about that earlier, just more so what is the work of the staff internally, because I'm a believer that if you don't work inside your institution to change how you all think, what you do, your mental models, it's really hard to do equity externally. It's hard to support a culture that values equity and actually has transformational change that can happen. So that internal work is critical. Building alliances, ensuring equity and innovation, and pushing upstream and fostering truth and reconciliation. In this talk, I'm going to talk about 2 of them. And so the first one you see is pushing upstream, very much rooted in the consequences and outcomes really of the Flexner Report of 1910. It's very clear I'm a public health person through and through, spent most of my career in governmental public health, and transitioned now more so in this healthcare space and ecosystem, and very clear of the gap in knowledge as well as skill set for many physicians and other healthcare providers in understanding these larger concepts around what really creates health foundationally, from social needs to social drivers to structural drivers rather, and also the root causes, all the isms of which create the lenses of how we set up policies. So whether it's ableism, sexism, white supremacy, homophobia, classism, there was a lack of knowledge, as most of us know in this space, especially within the medical school space as well as physician space. And what was really also important to me is that, and relevant, is that there's so much power in the healthcare space in terms of financial power and political power to drive a narrative around what creates health, where funding goes. And so if physicians, med students don't have a context to this broader context of health, we will always be in this model in this country of just kind of looking at the treatment approach to health and kind of the downstream aspects of healthcare. So rightfully, as I mentioned, we're shifting towards, a paradigm, and you all and Beyond Flexner has been pushing for this for years, that incorporates social and racial justice into our models. However, I think really equally paramount is the need to shift consciousness that relates to our consciousness and culture. There's a lot of focus and a tendency to focus exclusively kind of on the technical processes and the structures, which we all know are critical to change. But if your structures are not changing in an environment in which the culture is supporting that change, then it's really hard to sustain those structures over time. We see that right now in our country. We see it in our institutions all the time. And so what does it mean to kind of have education, you know, and you all are very aware of this and in tune to this, that kind of speaks more to building a consciousness around narratives. And this is where I left off really in my public health space. It was kind of the front line of health equity work, of really talking about dominant and malignant narratives and how they show up and how we understand them and how we have the courage to really name them, oftentimes in the faces of, you know, resistance in our institutions. And so I really believe that we can't undo or reimagine what we don't have the consciousness to see or the courage to really change or challenge. There are many things and ways in which these narratives show up that completely undermine equity. I won't go in depth into these, but we all know Dr. Kamara Jones speaks a lot to this now. I actually learned from Dr. Richard Hofrichter, who was the Senior Health Equity Director at the National Association of City and County Health Officials, about narratives and where they are, how they show up, and what we need to start doing to speak towards them. I think we have to build more consciousness as it relates to education and connecting those dots, that when we look at data, that these are really structured inequities that are in our policies and in our institutions as well. And these structures, what are they that are setting up and creating these narratives? What are the narratives that are upholding these structures as well reciprocally? And then in addition to other aspects of expanding and changing and shifting our consciousness and critical consciousness, we need to expand our typical frames again of how we talk about what produces health, and really challenge the political, as I mentioned earlier, and financial systems that really work to sustain and produce the inequities that exist. Many folks, hopefully by now, are familiar with Inflamed by Dr. Rupa Myra and Roger Patel. Rupa is a friend of mine, and I wrote actually a review in The Lancet on the book, and I think it's an opportunity, whether you agree with it fully or the perspective fully, it's an opportunity to challenge ourselves and to go, I think, and dig a little bit deeper into the roots of injustice within our country and really global society. And then another piece in terms of building our consciousness, it's about building a community, working collaboratively with others and in solidarity. These two pieces, myself, Nancy Krieger, who many of you are familiar with in the equity space, Rhea Boyd, who many of you are familiar with, and Fernando de Mayo, who many of you are probably familiar with, who's on my team at AMA. After the incident with JAMA last year, we had been thinking about this before that actually, but JAMA really kind of ignited us to kind of move forward in a direction to really highlight and look at the data as it relates to what was happening in the context of racism, what was being called out, what was not being called out and done. But I'll speak to the results in a second, but the important part for me, one of the important parts, is that we came together and we had to do this together. We had to think strategically, some of it covert, you know, and some of it overt. And I think that that's an important part of, you know, our education and our educating students and physicians moving forward. And so the results, just so that you have a sense of that, is, you know, out of the 200,000 plus articles that were published between 1990 and 2020, only 0.5% included the word racism, and 0.02% were empirical in nature. And so these are the 4 leading medical journals, which has a tremendous impact in how we do what we understand as it relates to racism. If it's not there, we aren't addressing a key system that we know causes harm and inequitable health outcomes. And so some of the tools that we've been pulling together as the Center for Health Equity and the AMA to sharpen the consciousness, we've been doing many of these in partnership with others, not totally in isolation, which has been really great and beneficial. This is a narrative guide that was released this past fall in partnership with AAMC and their Center for Health Justice. Really just speaking to, again, wanting to have a resource for physicians and students, any healthcare provider, and actually this has been taken up from people outside of healthcare as well. We've gotten really positive feedback with thousands of downloads, but really, again, understanding the importance of language and narrative to shift our consciousness, which means we'll shift our actions and how we decide and choose to do work. We've been working, and Joaquin Baca is here from our business unit of medical education in the AMA, and they've been working with med schools over the last years to kind of work collectively to drive change and to create ideas on what change could look like, funding programs that put students in proximity to patients, which I think is really important in terms of their homes and their neighborhoods in which they live, and conducting workshops, et cetera. We have launched on our AMA Educational Hub on the site a whole slew of resources as it relates to equity. Some of the content is brand new. We have partnerships with like COVID Black, and some of it's content that others, maybe even some in this audience, have created. And I put that plug out there that if you all, we're not looking to reinvent the wheel. If there's really great content that's already created as it relates to advancing equity, just let us know. And we like to do the partnerships. We definitely recognize and acknowledge those partners with their logo and brands on the AMA website as well. And then we're also working right now on a structural competency casebook and modules. This is in partnership with many of you for Jonathan Metzl, author of Dying of Whiteness, and along with Helena Henson, really have done a lot of work around structural competency and elevating that, and also with Uche Blackstock, who many of you are very familiar with. They are supporting our efforts in this, and hopefully we'll have something within a year or so to share with the environment. And then lastly, later this year, we will be launching an AMA Grand Rounds in partnership with ACGME, and Dr. Bill McDade, who is a colleague and friend, is over there at the table. Many of you all know. We've been working together on this with his teams, and we look forward to sharing that all with you as well. And so the next part that I'm going to speak to, and the other approach, is this context about history. And Kamar Jones, I became very familiar with this framework really during this time of COVID, put forward, 3 things and the importance of valuing individuals and populations equally. Our data shows us that we do not do that. Many folks will say, I do, of course we do. But the reality is that the impacts, the data shows us that we do not, and we have to hold that true. But important to that, and that she elevates, is recognizing and rectifying our historical injustices, and of course providing resources based in need. But I'm going to focus on rectifying the historical injustices. And I believe that no set of commitments to anti-racism can begin without an honest assessment of the institution's own history and present practices. And here's a list of some of the harms, but the strategic document itself that I elevated earlier actually has a whole list of them, and we've only really just begun to tap into the archives at AMA to learn more, and I'm sure we won't learn all that we need to learn from the AMA archives, and we're going to need to work with other folks, and so again, I encourage and totally open for people to reach out. Many folks know about the exclusion of Black physicians, and then there's the Flexner Report, which is actually less known, well known to you all, but less known to many others, and its impacts, especially as it relates to the closure of the 5 of the 7 Black med schools. But also Flexner, which doesn't get elevated as much either, really formalized into our system the ideologies of power and oppression that really were present in our society then as well as now. At that time, it aligned with white supremacy view of the world, really exposed by Plessy versus Ferguson, which upheld constitutionally racial segregation, and then also institutionalized hegemony of allopathic medicine and delegitimatize, sorry, I'm a little nervous, I'm nervous because I haven't talked in so long, so I apologize. Holistic systems of medicine such as indigenous medicine and homeopathic medicine as well. And so our approach is to foster truth, racial healing, reconciliation, and transformation of AMA's past. Part of that is amplifying and integrating often voices that have been, and stories that have been made invisible of historically marginalized physicians and patients, quantifying the impacts of AMA's policies and processes and repairing and cultivating a journey of healing. I think this is, this is one, all the approaches are important. This one is the one that I kind of lean towards the most, but it's going to be the hardest from my perspective, because really in this country, and definitely in medicine, but in this country overall, we have not gone through processes of truth and reconciliation and restorative justice and healing. It's all really completely new, and there's so much resistance against it as well. So many know we issued an apology in 2008 as our kind of that first step forward. Ron Davis was the president at that time, said we have the power to right the wrongs, and this was going to be a modest first step. And it got a little bit quiet at AMA until, again, 2014, the commission, and then the policies that came forward in 2018. Last year, our CEO, Jim Madera, he's doing his work, and he's done a lot of work and has grown a lot in understanding just the context and as what it means to have a strategy of equity and anti-racism work. And, he reads a lot and read some materials that were actually created by both jointly the AMA and NMA around the time of 2006, 2008. And when he read it and realized kind of the explicit and intentional nature of Nathan Davis to exclude, he really, I remember reading the email to this day, asked our building teams to remove his archive, or remove his bust from our 47th floor at the American Medical Association out of public view, and it will be placed, and it was placed into archives immediately for educational purposes. And then the board agreed as well to remove the name of Nathan Davis from the award. So that's, that's the father of AMA, and difficult for probably any institution to do, but also an important step. Not the biggest step that needs to be made, but a very important step. And then there's Flexner. Again, kudos and really thankful for the Med Student section and the Minority Affairs section of the American Medical Association. There were many other allies and sections that also supported this, but AMA recognized the harm that was caused by the Flexner report to historically Black medical schools and the diversity of the physician workforce and the outcomes for marginalized and minoritized patients. And so now my team, along with our medical education team, we're in a process to figure out what to do next. We are going to be creating a task force or a commission of some sort to engage folks who have experience in the space of truth and reconciliation, experience and context and knowledge related specifically to Flexner, but also kind of the history of medicine and the harms that have been done. So there's more to come over this year in terms of what we're going to create. But what's really clear to us is that there are a lot of questions that, really remain in this space. How do we individually and collectively mitigate the consequences and understand these costs? What are the right people and organizations to engage and guide? Do we engage others outside of healthcare, understanding where our society is? Do we cause more harm than good if we really can't acknowledge the costs and actually pay? And there are probably many other questions and other narratives that we need to consider. One thing, as I'm starting to get to the close of this, that doesn't get elevated from the Flexner report much is this narrative here that is highlighted in this quote that I think has actually been really particularly harmful. It directly comes from the report, and it really demonstrates to me how deeply the false notion of the hierarchy of human value based on skin color with white beings on top, white supremacy, is embedded into this report, but also the influence of this narrative throughout medicine now, clearly in the past, but especially now. It really further institutionalized the separate, segregated systems of care. It put forward the notion that the only reason that Black people should be trained as physicians was to treat Black patients. And so this is a notion that I'm challenging myself about, that the reality is that many of us are using this to justify the necessity and the importance of diversity in medicine. And I'm challenging myself to really be careful with that narrative. I understand the reality, the importance, the right for diversity in medicine, the right for opportunity to experience for all people, and I understand the building evidence in terms of race concordance. But our challenge and opportunity is to make sure that, were you all looking at the other slide that whole time? Okay, beautiful, great. So you read this? Okay, good, okay. So our challenge is, seeing how this narrative is really baked into the Flexner report and the impacts that it's had not only for Black physicians, but really all physicians that have been historically marginalized and excluded. And again, I'm not saying, race concordance is a bad thing, but I do think that there is an unrecognized burden with that narrative that is placed upon Black physicians and physicians of color. And that really, we need to work towards a healthcare system in which the responsibility and competencies to deliver high quality care to all patients is with all physicians and not just that of physicians of color. And so what else, has this false notion and malignant narrative of the hierarchy of human value really created and reinforced in medical education and medicine and society overall? What are the costs? And so some of the following slides are some of the harms from historical choices rooted in this false narrative. And again, it's while a lot of these slides have Black and engaged Black or elevating the context of Black communities and Blackness, it's not exclusive to those communities. But this is a study that many of you are familiar with, researchers, at George Mason University. They captured data of births in Florida from 1992 to 2015, basically finding that when cared for by white physicians, Black newborns were about 3 times more likely to die in the hospital than white newborns, the researchers found. That disparity dropped significantly when the doctor was Black, although Black newborns nonetheless remained more likely than white newborns to die. To me, that's just shocking to still happen. Many of you are familiar with this study from 2016 that really provided the evidence of the false beliefs about biological differences between Blacks and whites still continue to be in the minds of the medical system, but especially early on in med students, amongst med students themselves. Race-based medicine, most of you are very familiar with this article, I would imagine, and all the algorithms and the clinical algorithms that exist. We have some hope on the horizon with NFK and ASN recommending to remove the race correction and presenting a race-neutral formula. And then there's this that I'm sure many of you saw, hopefully. This went viral within probably the end of 2021, I think it was. I can't tell if it was 2022 or 2021. But this brilliant med student started to, at the university in Ukraine, med school in Ukraine of all places, began to illustrate because he saw a gap. And I remember when I first saw this photo on LinkedIn, it's one of those moments where you're like, that's right. I don't see that. There is a gap. And that lack of a diversity in so many aspects of what we do visually creates tremendous and a lot of narratives that perpetuate our inequities in this society and in medicine more specifically. And then lastly, narratives built into our education. We see these attacks on race-conscious medicine, on education overall, and not only on medicine and education, but clearly the people who are also leading the work. And some of you are familiar with the experiences of Bram and Michelle up at Brigham's, myself, and many others across the country who are, I guess, now at risk for being harmed in ways that we hadn't thought was going to happen. So moving forward, I believe, the opportunity again for us as continual students, is to learn more. There's a lot more out there in terms of content that challenges typically how we understand health and medicine. So JAMA tends to get a lot of attention, the Journal of American Medical Association. And I'm in AMA, and I really think a wonderful resource is our American Medical Association Journal of Ethics. They have been publishing works and people and elevating marginalized resources, physicians, other providers, other types of providers within the Journal of Ethics for years. And so, you know, it's one of those kind of power financial things that happens at an institution and what's valued. But I highly, highly encourage folks to check out the American Journal of Ethics, but just overall, just really challenging us to increase our knowledge and our mental models as we move forward in this work, and how do we embed that into our curriculums and other education modalities. Identifying frameworks, this is again by Michelle Morrison Brom Winspley. I never say his name right, and he knows it, so he'll forgive me. But it's identifying frameworks that we know can be measured, can be incorporated into our systems and into our curriculums. And this is the Healing Arc framework. The acknowledgement involves recognition and admission of the wrong of our perpetrators and beneficiaries of injustice, our redress, our direct solution to monitor and end health inequities, closure, the institution and the people in the communities harmed agree that institutional debt is paid. And so I think we have an opportunity to kind of build and engage more in that space and light. And then lastly, the context was already mentioned, the importance of organizing and operating in solidarity, especially during this time. I think that this is an important context of medical institution leadership, medical education. We saw this need, especially recently with what did happen at Brigham's, with the neo-Nazis showing up and being present. And it was quite illuminating to see how silent the medical community was as it related to that. There were only two to three large entities that put out a statement against racist attacks against physicians. And I just don't believe that we're going to be able to move forward with a social mission in medicine and medical education if we don't step up and have more courage to step into solidarity and in partnership with each other and others that are actually experiencing this injustice and harm as it's happening. And so this leads me to my closing. I know I went over time, but we said we had like 90 minutes for two people, so I apologize. But, you know, for me, I tell this story often in coming to the AMA. I didn't know J. Marion Sims was a former AMA president until I came here, but I knew about J. Marion Sims because of his statue in New York City, and I was deputy commissioner in New York City. I spent a lot of time in New York City, and I knew about the organizing that was happening years before to get this statue down out of Central Park. And when I think about the context of healing and restorative justice, I come to this just personal experience personal experience of engaging with this whole narrative. And it's really hit home hard now that I am at the AMA. This photo depicts Sims on the right-hand side with three women who were enslaved, Betsy, Lucy, and Arca. He performed vaginal procedures to repair the vagina, also had some contributions to innovation in gynecology as it related to the speculum. And basically these procedures that he performed on these women were performed without anesthesia and multiple procedures. And it's well documented, and it's well documented because he wrote his own autobiography that documents it. And I always speak to, and I elevate this because Joya Career-Perry, who's also a physician leader, really speaks to the role of innovation kind of to preserve our institutions of capitalism really in this country, and the preservation of the Black women's womb was critical to doing that. And so again, it's challenging the narrative and how we think about innovation throughout the context of medicine, but also like how we educate around what we're doing in medicine. And so this was 2019, this was right before I came to AMA. The year before, the mayor, who was de Blasio at that time, pulled together a commission to assess the statues across the country. This was across the city. This was happening across the country. And this was the statue that was voted to be taken down by the commission. You are going to hear from Harriet Washington a little later, but she's in the middle of this photo, who wrote Medical Apartheid, and really for many of us exposed that story of J. Marion Sims that we had not heard. And on the right-hand side is Lynn Roberts, who is one of the co-founders of Sister Song and the co-founders of the reproductive justice movement, of which we honestly get a lot of our frameworks from in equity from the reproductive justice leaders in movement. And then on the furthest right-hand side, while I was standing there and the statue was coming down, there was a woman who was in the neighborhood who was running by. She does this every day, she said, and as she was running by, she stopped and she was in shock. She couldn't believe it was coming down, and she just turned and asked, could she have a hug? And we both just started tearing at that moment. And I will never forget the moment. I still have all the feels from it to this day. But the reality of like structures being able to come down, the humanness of it, the feeling of it, to me is what is most important in this space of medicine. We can create business cases, we can create science and data cases, but there's the moral case, the realities, and the rights that we all deserve, these opportunities to experience and get to a point of optimal health. And how do we keep that as our lens and not get distracted by a lot of the over-intellectualization that I see happening in this space of equity, and really centering, again, the voices and those who, and the ideas and the people who have been historically harmed in this country. So this was opened last year in Montgomery, Alabama. This is Betsy Luciana Arca. This is at the Mothers of Gynecology Park. And again, just speaking to the ability to shift the narrative. So instead of centering Sims, how do we center these women, their lives, and all the lives that were around them? And lastly, I've evolved. I am evolving, and I think when you start to have threats towards your life, like you start to see things very differently and more pointedly, and just have a different sense of, I wouldn't say it's courage, but the reality is like, I do this work because I love my family, I love myself, I love my community, and I feel we all deserve this ability to have optimal health. That is why we do it. That's why we all do a lot of things, is because of the love that we have for ourselves, our families, and our communities. And so if we can get to that point, I feel like we can really, and a point of connectedness around that, I think we can push a lot of paradigms. I know it's not popular, I know it's not common, it's not what dominant culture is typically about. But I don't understand how we wouldn't shift forward. I don't understand how to shift forward, rather, without having that context. So thank you, everyone. Appreciate it.